This educational video on VORAXAZE, Glucarpidase, is brought to you by BTG International. Various strategies have been employed to target rapidly growing cancer cells within the body. This includes Methotrexate, which can be used to induce the apoptosis of such cells. Methotrexate is a chemotherapy drug widely used to treat hematological malignancies, including acute lymphoblastic leukemia, primary CNS lymphoma, and non-Hodgkin lymphoma, as well as solid tumors such as osteosarcoma. Methotrexate inhibits dihydrofolate reductase, or DHFR. DHFR converts folic acid into tetrahydrofolate, an essential building block of DNA and RNA. Inhibition of DHFR prevents DNA and RNA synthesis, creating a cytotoxic effect that promotes apoptosis. More than 90% of methotrexate is cleared by the kidneys. However, methotrexate is poorly soluble, and pH changes within the kidneys can promote its precipitation, which can result in acute kidney injury. This can cause renal failure, leading to a vicious cycle where methotrexate accumulates within the body due to reduced renal clearance. This can cause other systemic toxicities such as myelosuppression and mucositis. Nephrotoxicity causes a delay in the elimination of methotrexate, which exacerbates its toxicities, including the GI tract, hematologic, and hepatic, which can be fatal in some patients. The molecule leucovorin can recover DNA synthesis in cells by replacing folates, preventing some of the toxic effects associated with methotrexate. However, leucovorin does not clear methotrexate from the body, and in some patients, 2% of children with osteosarcoma and up to 24% of adults greater than 70 years of age with primary CNS lymphoma treated with high-dose methotrexate, leucovorin is not enough, as acute kidney injury can arise, an oncologic emergency requiring additional therapy to reduce toxic plasma methotrexate levels. This is because leucovorin and methotrexate compete for the same cellular transport system. Therefore, when methotrexate levels are high, leucovorin might not be enough to rescue cells from this inhibition. VORAXAZE, Glucarpidase, is an enzyme that rapidly hydrolyzes plasma methotrexate into inactive metabolites DAMPA and glutamate, which are eliminated via the liver and kidneys. In a single-arm, open-label study of 22 treatment-evaluable patients, VORAXAZE demonstrated a rapid and sustained clinically important reduction, or RSCIR, of toxic plasma methotrexate concentrations in 45% of treatment-evaluable patients. Based on the primary endpoint of the proportion of patients achieving an RSCIR defined as less than or equal to 1 micromole per liter at 15 minutes sustained for up to 8 days in plasma methotrexate concentration following initial injection. In an exploratory analysis suggesting the likelihood of obtaining RSCIR before and after the first VORAXAZE injection, VORAXAZE reduced plasma methotrexate concentration by greater than or equal to 97% within 15 minutes in all 22 treatment-evaluable patients. Because VORAXAZE works in blood plasma and leucovorin works in the cell, continue to administer leucovorin until methotrexate concentration is maintained below the leucovorin treatment threshold for a minimum of 3 days. Hydration and alkalinization should also be continued. In January 2012, the FDA approved VORAXAZE for the treatment of toxic plasma methotrexate levels greater than 1 micromole per liter in patients with delayed methotrexate clearance due to impaired renal function.